So it is my pleasure to introduce today's John Hanks Lectureship. As many of you know, Dr. Hanks passed away last year, and this lectureship will continue to memorialize him as a remarkable surgeon, mentor, and a professor and colleague here in our department at UVA. Dr. Hanks' journey in surgery began with a deep love for learning, as well as dedication to excellence. Following medical school, he attended University of Rochester, where he was mentored by the legendary Dr. Seymour Schwartz. For those that you don't know, that's the Schwartz surgery textbook. Dr. Hanks pursued his surgical training at Duke University. And at Duke, he had the opportunity to work with Dr. David Savaston, a period that shaped his career and allowed him to build connections that would eventually bring him to UVA. It was then with Dr. Scott Jones, our former chair of surgery here at UVA, who recognized John's potential and recruited him to UVA, a decision that would have a lasting impact on our department as well as our institution. After joining UVA, Dr. Hanks quickly distinguished himself not only as a brilliant clinical surgeon, but also as an investigator and an academic leader. He earned the rank of full professor by 1990 and was appointed the Morton Professor of Surgery in 1993. He was the inaugural chief of division of general surgery, and Dr. Hanks oversaw a period of tremendous growth and innovation. His leadership extended way beyond UVA. He had significant contributions as a director of the American Board of Surgery, and also was a past president of the Southeastern Surgical Congress and the very prestigious Southern Surgical Association. But it was not just Dr. Hanks' accolades or roles that defined him. Many of them in this room will understand he was an extraordinary mentor who guided students, residents, as well as faculty here. He led by example, imparting lessons that went way beyond the technical aspects of surgery. He taught how to navigate the complexities of academic medicine. And he was able to engage thoughtfully in helping mentor how do we navigate professional societies. But most importantly, he taught us how to treat individuals with dignity, respect, and compassion. So it is really my great honor to have Dr. Schirmer, who's one of Dr. Hanks' close colleagues and friends, to be able to give this lecture today. And I'll have Dr. Hollowell give an introduction for Dr. Schirmer.
Thank you all. It's my distinct honor and pleasure to introduce a man that probably doesn't need much of an introduction to most of this room. He's been my friend, mentor, and colleague for the last 17 years. As you may know, Bruce grew up in New Jersey. He went to Princeton and then to Duke for medical school and stayed on for Duke for residency. He managed to finish residency in less than 10 years. And managed to stay married to his lovely wife, Jerry, during that time. He met R. Scott Jones in the lab and was recruited here in 1985 to join the faculty with Dr. Hanks, Dr. Jones, and with Dr. Schenk. He rose through the ranks here. He is currently vice chair for education. I think one of his top honors that he would say is he's won the teaching award innumerable times. And in fact, now the teaching award is named after him, and I think he may not be able to win it. He's held almost every office you can in American surgery. And if I continue on with this, we'll never get to hear his talk. So I introduce to you Bruce Schirmer.
Well, thank you so much, Pete. I really appreciate that kind introduction. It's really pretty much the way I wrote it, so thank you. No, I was really honored last year when John asked me to give this lecture, and it's my distinct honor and pleasure to be able to do that. Give this will be the fourth Hanks lectureship given for my good friend and colleague, Dr. John Hanks. So I don't have any conflicts of interest. This is a subjective talk. I'll begin by saying I'm certain to forget somebody, and I apologize in advance. And I'm sure that I won't get all the details right, but I will emphasize mainly the period of time from 1971 to 2017. Information sources from C. Bruce Morton's book, There is a History of the Department of Surgery, that was written in 1971. Articles about James Cabell and research in the coming book that I'm doing for the Department of Surgery. More on that later. The O-Drive faculty website, The individuals listed on this slide were key in giving me a lot of great information, and I thank them also very much. And now let's start and talk about John. Dr. Sung has given a great summary of Dr. Hanks's career, but I can tell you that John was an amazing guy. He was a great mentor, a great friend. I met him when I was a medical student at Duke when he was a resident. He was a colleague, friend, mentor, and supporter ever since. We really miss him. John was born in Maryland in '49. He attended the Landon School. He and his two older brothers all were Princeton grads. John was class of '69. He then went to Rochester for his medical school training and did his residency at Duke. When John first went to Duke, he was actually a neurosurgery intern, but then was recruited to the general surgery program by Dr. Sabiston. After 2 years at the NIH and 2 years in the lab for Dr. Jones, he finished his residency in 1982. Dr. Jones, having recognized his immense potential and merits, hired him in July of 1982 to start in the faculty. This is a picture of John when he finished his residency. The best thing John did when at Duke, in addition to doing his training, was to meet Bonnie Bolton, who he married. She was the head nurse in the OR at UVA at the time, became his wife, and had been happily married since that time. John and Bonnie have two lovely daughters, Laura and Mary, pictured here. And I think Laura's on the call, and thank you so much for being here. We can't talk about John and not mention Sandy. Sandy and John were like the Bobbsey twins. They were cohorts and colleagues in residency, and when it came on the faculty at the same time, helped each other, really rejuvenated the general surgery grouping and energy in the department and the general surgery side. This is a picture of Sandy before this tragic plane accident in 1984, after which he suffered significant burns to his face and hands and had to have multiple operations in order to resume his career. The true grit of surgery, who we lost also a year and a half ago, and we miss him greatly as well. Now, John's clinical contributions began. He was a general surgeon. He had a broad interest in GI, breast, and endocrine surgery. Later evolving into endocrine, he became our sole endocrine specialist by 2000 and recruited Philip to help him as his partner in 2011. Here's a good picture of John as the ultimate professor doing ultrasound teaching of the neck to some residents. John's research contributions started with investigating hepatic glucose metabolism in the glucose clamp model. He obtained NIH funding for that. He later did many papers on clinical topics of breast endocrine surgery and surgical education. His UVA accomplishments included being the C. Bruce Morton Professor, First Division Chief of General Surgery, President of the Credentials Committee, and President of the Clinical Staff. He was also nationally the President of the Southeastern Surgical Congress, received the Lifetime Achievement Award from that group, was a Vice President for of the Surgical Endocrine Society, Director on the American Board of Surgery, and most recently, President of the Southern Surgical Association. This is a great picture of John, and all I can say is I miss you, my friend. Much of this talk will be focused on the leadership of the department from '71 to 2017. I will not say anything, unfortunately, about the staff and residents due to lack of time, but I do want to begin by recognizing that it is the work that they do that allows us to achieve the accomplishments that we have in the department. And also want to thank the many thousands of patients who have basically given their lives to us, trusted their lives to us to accomplish our craft and achieve the things we've done. Jefferson started the university in 1818. 1825, Robley Douglinson was our first professor at medical school. Johnson, the first professor of anatomy. And there were some medical students right in the very beginning. During the 19th century, there were 6 heads of surgery dominated by James Cabell, who was chief of surgery for most of the century. The hospital at UVA didn't really start until the 20th century. It was a Civil War hospital that closed down, and there was only a clinic in town until 1886, when Paul Barringer opened a first hospital, which was then torn down for the first pavilion of UVA Hospital, which currently still exists, 1901. Here are some illustrations of the anatomy hall, infirmary, the hospital bed facility, and the nursing quarters. In the 20th century, there have been only 8 chairs of surgery. They're all listed here, The ones in yellow are the ones that I'm going to emphasize in this talk. And unfortunately, I just don't have enough time to really give merit to the folks since 17 and the folks before 71. Dr. Stephen Watts, though, started the department in 07. He was a Hopkins graduate, a Halstead resident, and was chair from 07 to 28. The hospital at that time was a little over 100 beds, and half the patients were his own patients. Dr. Ed Lehman was the next chair of surgery from 28 to 53. He was born in Philly, did his undergraduate at Williams and his Harvard Medical School, residency at Barnes, faculty at Barnes, and then became our chair in 1928. He was president of the SUS, the Society of Southern Surgical, the American Surgical, and on the board of surgery. The faculty at that time grew from 3 to 7 under his tenure as faculty chair. This was the department in 1953, the year that C. Bruce Morton was the interim chair between Dr. Lehman and Dr. Muller. That was the entire department pictured right there. This is a book that Dr. Morton wrote, and I recommend it to you for all the facts before 1971. Dr. Harry Muller took over as chair in 1954. Dr. Muller was born in Dillon, South Carolina, and went to the Citadel undergraduate, got his MD at Duke, and was a Hopkins resident under Alfred Blaylock. He actually had a fairly short residency, which included military time. Dr. Blaylock recognized his clinical excellence and promoted him to chief resident fairly quickly. Dr. Bill Longmire then recruited him to help start the UCLA Medical Center, where he was an assistant and associate professor for 6 years. He was chief on the heart service at Hopkins before leaving there, and his research focus was on pulmonary hypertension. He developed the pulmonary dam and pulmonary artery banding to decrease blood flow for congenital shunts. He did a lot of aortic valve pioneering work at UVA when he was chair. He was nationally the president of the SUS, the Society of Vascular Surgery, the Southern, the American Surgical, and the College of Surgeons. Dr. Muller was chair for 28 years, from 54 to 82. He greatly expanded the faculty and grew to 1970. There were 4 professors, 4 associates, 3 assistants, 14 clinical faculty, and 4 instructors. The clinical volume of the hospital greatly increased in 1959 when they opened a multi-story building, which had a total of 620 beds. He also revamped the teaching program and research efforts as well. Leading faculty in the early Muller years, Dr. George Miner was the main thoracic surgeon. He taught everyone how to do bronchoscopy under local anesthesia. Dean Warren went on to be chair at Emory and was famed for his work in portal hypertension. Dr. James Littlefield was the chair, went on to be chief of surgery at Canada and Nova Scotia. Dr. Stephen Wangenstein was the son of Owen Wangenstein of Minnesota. He then went on to be chair at Arizona, where they did one of the first artificial heart implants. Dr. Sheldon Horsley went on to MCV for most of his career. And during the 70s rather, Dr. Anthony Shaw was our pediatric surgeon. This is a picture of Dr. Wally Ritchie, also a main faculty stalwart. Wally did his med school at Hopkins, residency in Minnesota. He was in the Army for a number of years and then joined our faculty in 73. He was an international expert in GI physiology, especially peptic ulcer disease. After being on our faculty, he took the chair at Temple and was there for 10 years and then became the executive director of the American Board of Surgery. Les Rudolph was recruited to our faculty after having done his MD at Cornell and residency at the Brigham. He joined our faculty in 63 and in 67 did the first renal transplant here at UVA. By 74, he was the vice chair of the department and head of the surgery training program. Dr. Stan Nolan did his training here at UVA, residency and fellowship, did NIH research and rejoined our faculty in 68. He succeeded Dr. Harry Muller as the division chief of TCV and was the Claude Jessup professor and chair of the chief of the division from 1981 to 88. Dr. Muller, he really did an amazing stuff as chair, but then also went on to become the executive vice president for health affairs by 1980. During this time, he served both as the chair of surgery and the executive vice president until he retired in 88. He held that position of EVP till 88. He was simultaneously fulfilling obligations to national leadership groups like the college and the American Surgical. He was really juggling a lot of balls at once. His 2 major accomplishments as EVP were that he was the driving force behind the construction of our current hospital, which was called the Replacement Hospital, which opened in April of 1989. He created the Health Services Foundation to improve funds for faculty and improve benefits. Funds from the Health Services Foundation funded major projects like the Ambulatory Surgery Center, lithotripsy, and Gamma Knife. Other faculty during Dr. Muller's time, Dr. Ritchie, I've spoken about. Jim Chandler, there was Harry Wanabo, who was an oncologist, went on to be chief of oncology at Brown. And then Brad Rogers joined during Dr. Muller's last year as chairman and was on our faculty as head of pediatric surgery for many years. Also, Dr. Ivan Crosby was one of our cardiac vascular surgeons during Dr. Muller's years, was on the faculty from 72 to 84, left and came back in 2000, recruited by Dr. Crone and Jones. The same was true for Dr. Burt Wellens, who was on faculty about the same time and followed a similar course. MC Wilhelm did his medical school here and did his residency at Virginia Mason, then was in the military and practiced in Seattle for a few years. Then he went and joined the faculty at the staff at Martha Jefferson, and Dr. Muller recruited him to be a full-time UVA faculty in 1980. Dr. Wilhelm was an extraordinarily technically great surgeon. His patients really loved him. He was a founder of the Breast Center and helped found the UVA Cancer Center and was very active nationally in breast cancer databases. Dr. Rogers, he did his MD at Hopkins, residency at Duke, and his fellowship at Montreal, came on our faculty in '81. He was pediatric surgery for many years. He was literally the Lone Ranger for a number of years until Gene McGarren joined him. And Brad and Gene were basically what constituted pediatric surgery for many, many years. He was nationally well known. He was the president of the Association of Pediatric Surgeons and served on the American Board of Surgery and the Residency Review Committee. In 1968, the residents who were trained under Dr. Muller found a surgical society to honor him. It later became the Muller-Jones Society and now is the Muller-Jones-Crohn Society. Here's a picture of Wilkes Hubbard and oh gosh, I'm blanking on his name. These were guys at this is one of the first Muller-Jones, Wayne Ferguson. These were one of the first Muller-Jones Society meetings. Obviously, they had a pretty good time in those days. There's a picture of Dr. Muller that hung in the lobby of the new hospital for many years. It is no longer there, but I think it's a great picture of Dr. Muller. This is Dr. Muller greeting Dr. Jones on his arrival at UVA in 1982. Now we're going to talk about Dr. Scott Jones, my mentor for my career, somebody I owe a great deal of debt to. Scott was born in Tyler, Texas in '37. He got his MD from UTMB, his residency under Dr. Rhodes at Penn. He went to UCLA for a year as a physiology fellow under Dr. Mort Grossman's lab, and then went to the faculty at UCSF, where he was clinically active as well as did his research at the San Francisco VA. Dr. Sappison recruited him to Duke in 1972, and then he spent a decade at Duke University. During those years, he was on NIH study sections. He had a joint appointment in both physiology and surgery. I first met Dr. Jones my first week of medical school when he gave the medical school introductory lecture on GI physiology to the first year students. He had NIH and VA funding, and he had an amazing surgical practice. He was the go-to GI surgeon at Duke. He then became the go-to HPV surgeon here at UVA when he became our chair. Scott epitomized patient care, and I can tell you that from a personal perspective. Scott was chair for 20 years. He greatly expanded the clinical and research missions. He emphasized the importance of teaching and residency training programs. He established programs in transplantation, oncology, trauma, and minimally invasive surgery. He was president of the SSAT, the Southern Surgical, the American Surgical, and the American College of Surgeons. He also served on the Board of Surgery and was on the RRC and was chair of the RRC for the last several years of his time there. His retirement, quote unquote, occurred in 1982 from our department. He then took on the directorship of the American College of Surgeons Division of Research and Patient Safety, which he founded and established from 2002 to 2007. Scott then really did retire for a number of years. And before he did, though, I should have mentioned that he also established the NSQIP program, both here and at ACS. He was a strong advocate for patient safety and quality. He returned to the faculty to obtain his master's in surgery and surgical science and did that at the age of 80 years old. He since has written papers on surgical errors and quality care until retiring last year in 2024. This is a picture of Dr. Jones and Muller and Dr. Ed Laws, who are the three UVA presidents of the American College of Surgeons. Picture of Scott with his immediate staff, Diana Hutchins, Sharon Jordan, Scott, Clark Nesbitt, our business manager, and Marge Pennington. Scott's smiling in this picture. I love this picture. Scott has a lot to smile about because he did wonderful things for our department for the 20 years he was our chair. Faculty Scott recruited. In the beginning, Irv Krohn and Robert Menser rejuvenated cardiac surgery. John Hanks and Sandy Schenk rejuvenated general surgery. He hired Tom Daniel to replace George Miner as our main thoracic surgeon. Irv became the 5th chair of surgery. I have a lot more to say about him in a few minutes. Robert Menser did his training here at UVA, research with Dr. Byrne in physiology. He joined the faculty in '82. He advocated for heart transplants, and when the cardiologist said it would never happen here, he went on to become chief of cardiac surgery at Buffalo, then chair of the Department of Surgery at Kentucky, and dean of Wayne State University. John, we've talked about. He was really an amazing addition to the faculty. He and Sandy rejuvenated general surgery. They unfortunately were both injured in the plane crash in '84. It took John 6 months to get back into clinical practice, but he certainly did, and his leadership, mentorship, and collegiality have been emphasized, and I can't emphasize them enough. This is a picture of Sandy after the accident. Sandy got here, created a level 1 trauma center in just 1 year. He then, after his accident, had to take up vascular access because that's all he could do with his fingers, but he did it amazingly well, amazing results. He was an expert in ultrasound. He was our quality officer for a number of years, and he won teaching awards as well, including the Harrison Award. Tom Daniel was recruited by Scott after being in private practice for a number of years in Richmond. He had trained at Duke and knew Scott from that time. Scott recruited him to our faculty, and Tom was then our main thoracic and vascular surgeon for a number of years until his retirement. He also was very active in our global surgery program toward the end of his time on faculty. Other faculty early on in the Jones years, Kurt Tribble, myself, Bill Spotness, famous for fiber and glue, Tim Pruitt, our first transplant surgeon, Craig Slingloff, and Gene McGarren. Steve Edge was an oncologist who went up to Buffalo to finish his career there. Bill Stevenson was was our first liver transplant surgeon. Yano Manassi was the program director before me and went into industry and then private practice. Chip Foley was our first colorectal surgeon. He then went on to Wisconsin to be the program director there. Jeff Young is of course, our trauma surgeon. Reed Adams, I'll talk more about him as well. And Mike Ishitani was a pediatric trained and transplant trained surgeon on our faculty during the 1990s. Robert Sawyer was recruited in '96. A lot more to say about him in a minute. Hilary Sanfey came to us from Ireland, and she was a transplant surgeon and general surgeon during the 90s to 2008. John Kern, who's of course still on our faculty. David Jones was our thoracic chief from '99 to 2014, and now is up at Memorial Sloan Kettering doing this, head of the group there. Nancy Harthen was trained by us and was on our faculty in vascular surgery for 10 years. And then Charlie Friel was recruited in 2001. Kurt Tribble, he got his MD at Vanderbilt, came to UVA for residency, did his TCV fellowship and research fellowship. He is here as well. Soon after joining faculty in '87, Kurt became the clerkship director and the program director. I will have to say that I think there's no question that Kurt instilled the greatness in our training program by making teaching a mandatory part of daily rounds. The residents would quickly learn that this was going to be that way we did it. We not only talked about the patients, but we taught on rounds. He established that tradition in our department, and I think that's what really was the kernel of growing greatness in our department in the terms of the teaching and education aspects. He was the vice chair of education for many years. He was director of the heart and lung transplant program with Dr. Krohn, started it on the American board, served on the American Board of Thoracic Surgery. He then left UVA to be the vice chair of cardiac surgery at Florida, and then did the same position at Mississippi before rejoining our faculty in 2014. He's now the associate program director in of the thoracic residency. That's me, and you've heard a bit about me in the beginning. Craig Slingloff, Craig was my intern at Duke. He did his medical school here, but then did his residency at Duke, where he did research with Hilliard Sigler, focusing on melanoma. That became the focus of his career. Craig is the epitome of a surgical investigator. He has had NCI continuous funding for 25 years. focused on melanoma vaccines, has been the head of 19 clinical trials. He is the Joseph Helms Farrell Professor of Surgery. He's been a director of the Cancer Center and Human Immune Therapy Center and the co-chair of the ECOG Melanoma Committee and is currently our vice chair for research. Gene McGarren trained with us as well after getting his MD also from UVA, did his fellowship in pediatric surgery at Washington, then joined our faculty. He was the clerkship director for many years, during which time it won accolades as the best clerkship. He's been the division chief of pediatric surgery since Brad retired. He's also been the chief of the Children's Medical Center till recently and has won the Harrison Award in teaching, an amazing teacher and clinician. Jeff Young joined our faculty in '94 after having done his trauma residency at Wake. He was the immediate director of the Trauma Center, elevated our trauma program to new levels, became the senior associate chief medical officer very quickly, was a service line director, a quality officer for the institution, and he's also a surgical father for both Andy and Steve, who are in our general surgery and cardiac surgery programs, respectively. Reed Adams became our 7th chair of surgery. I'll talk about him in a little bit. When he joined the faculty, he had done his medical school and residency at UVA finishing in '94, winning numerous awards. He did his fellowship at Toronto for a year with Bernie Langer and became the Claude Jessup Professor by 2009. Was our first division chief of surgical oncology. Was on the American College of Surgeons ultrasound faculty. He's been president of the HPBA and the Society of Clinical Surgery, director of the American Board of Surgery, and chaired the Board of Complex Surgical Oncology and helped get that fellowship started while he was on the board. He became our 7th chair of surgery in 2019. Robert Sawyer did his MD at Michigan. We recruited him to our residency. He had a great interest in research investigating in infectious diseases, wrote numerous articles, mentored many residents. He did his transplant fellowship at Michigan and rejoined our faculty in '96. He was Mr. ICU, directing the SICU, as a director of the Critical Care Fellowship as well. Started the division, became the first division chief of acute care surgery. He was the president of the Surgical Infection Society. He then left our institution to become chair at Western Michigan in 2017. He has now succeeded to be dean at that institution, and we are very pleased that he will be our Moeller lecturer next month. John Kern, you know very well. John did his medical school residency here at UVA, as well as his fellowship in thoracic and vascular surgery. He joined our faculty in '98. He's been the director of the heart transplant and the mechanical assist device programs. He's been the surgical director of the Heart and Vascular Center. He's won teaching awards, including the Socrates Award, and he has great expertise in cardiac and vascular surgery, and certainly one of the most gifted technical surgeons I've ever trained or worked with. Charlie Friel, MD from Harvard, residency in New England Deaconess, and his fellowship in colorectal surgery at the University. Joined our faculty in 2001. He was the colorectal chief starting in 2007. And he's been a director of the DHC and became program director in 2017. Charlie has won every major teaching award the institution has to offer, including being the Robley Douglason awardee, Harrison Award, Master Educator, Leonard Tau Humanism, and numerous others. He is currently serving also on the board of colon and rectal surgery. Other faculty at the end of Dr. Jones's and the beginning of Dr. Crone's tenure included Ivan and Crosby and Burt, who were hired back, and Ben Peeler did cardiac and pediatric cardiac surgery during the 2000 era. This is a great picture of Dr. Jones and Dr. Crone passing the baton. Dr. Crone took over for Dr. Jones in 2002 after having done a co-chief 2 years. Dr. Crone is our 5th chair of surgery at UVA. Great picture of him in the lab. Dr. Crone was born in 1950, got his undergraduate degree at Penn, his medical school at Medical College of Wisconsin, did his residency at the University of Maine, and his fellowship in cardiac and thoracic surgery here at UVA. He was the last fellow to work with Dr. Muller. He became the Muller Professor of Surgery in just 8 years by doing that by 1990. He is an amazing investigator and scholar. I just can't, it's just astounding the number of publications, over 550 publications, continuously funded since 1986, NIH funding since 1992. He's been the PI on over 25 grants. He is the most prolific author in the annals of thoracic surgery history. He's won the Bakken Scientific Achievement Award from the STS and the UVA Distinguished Scientist Award as well. His national leadership was also amazing. He's been on NIH study sections, served on the board of surgery and the board of thoracic surgery, was on the RRC for thoracic surgery, for which he was the chair of that group. He's been the president of the STS and the AATS, on the Associate Executive Committee for the American Heart Association, and on the Board of Governors for ACS. Irv was not just sitting in his office. He had an incredibly busy clinical practice, often had the most RVUs in the whole department. This led to the growth. He led the growth of the department from 24 to 48 clinical faculty during his 15 years as chair. He increased our research mission to place UVA in the top 25 of the country, and doubled our grant funding from just over $3 million to $6 million annually. He established the divisions of acute care surgery, vascular surgery, and surgical oncology, and increased our research faculty and staff as well. He developed the leading training program in cardiothoracic surgery in the country. He started his first year as here, the Resident Research Day, which we've continued since. He promoted teaching the mission of the department and established faculty incentives for scholarship. Irv stepped down as chair in 2017, only to take the 1 year later to go on to the University of Arizona to be CEO of that College of Medicine and the senior VP for their health system for 4 years, after which we were fortunate that he returned to UVA in 2022 and has been managing his research grants and contributing greatly to our department in that way ever since. Faculty under Dr. Crone's years: David Brennan, Annika Schroen, Ken Brayman, Wayne Ferguson briefly, Ken Cherry, and Todd Bauer. David did his medical training at NYU Med and then residency and fellowship at Northwestern in breast surgery. He joined our faculty in 2002, has been the head of the breast program, and has been a pioneer in using focused ultrasound for treating breast disease. Annika did her training at UT Southwestern for residency and fellowship, UNC for an MPH, joined our faculty also in 2002. She's been the director of the breast program at Culpeper and the vice chair for faculty development. Ken joined us from having spent time at Penn. He did his training there, med school residency, fellowship at Minnesota for transplant, was on the Penn faculty for a number of years developing their transplant program, and Dr. Crone recruited him in 2002 and established the islet cell transplant program here at UVA. Ken served as division of chief of transplant for many years as well. Ken Cherry, he did his medical training here at UVA, graduating from our residency in 1980. He then went on to do a vascular fellowship at UCSF and became chief of vascular surgery at the Mayo Clinic and developed a national and international reputation in vascular surgery. He served on that at that institution until 2004 when he was recruited by Dr. Crone to be our first division chief of vascular surgery. He helped us transition to the endovascular era and started the vascular fellowship. A great friend of our department. Todd Bauer came to us from Penn as well. He did his residency in medical school there, then went on to MD Anderson to do his fellowship as well as extra research. He joined our faculty in 2005. Todd has been a surgical investigator as well, focusing on pancreatic cancer during his years in his research. He's also been an excellent clinician in HPB and pancreatic surgery. He has an NIH-funded lab and is our division chief of surgical oncology. Faculty during Dr. Crone's years also included Tim Schmidt in transplant, Gaurav Elawadi, who is a great cardiac surgeon, is now chief of cardiac at Michigan, Ben Kosauer, a thoracic surgeon who's at the head of thoracic at Barnes in St. Louis, Forrest Calland on our general surgery faculty, Chris Lau, who is the chair of the Department of Surgery at Maryland. She's a thoracic surgeon, and Avi Agarwal, who is one of our great transplant surgeons, stalwart on the faculty. Unfortunately, Avi died in 2022, and we miss him greatly. Pete Hallowell joined us in 2008. He's become my partner, and I'll have more to say about him. And Jay Ganjemi, Megan Tracy, Tracy Hedrick, Gib Upchurch, and Carlos Tache Leon all joined the faculty between 2008 and 2010. Pete did his medical school at Howard, residency and Case Western. He was on their faculty there, and I recruited him to be my partner in 2008. He's been an amazing colleague since, director of the surgical clinic, the MIS fellowship. He's done more robotics cases than anyone else in the institution, and he's currently the president of the Midwestern Surgical Society. Jay Ganjemi trained here at UVA after having done his MD at Rochester. He went back to Rochester to do pediatric fellowship and stayed on their faculty for a number of years. Dr. Crone recruited him back to UVA in 2009. He's been director of our congenital heart program, pediatric ECMO programs ever since, often splitting time between here and Norfolk and VCU as well. This is a great picture taken in 2010, Dr. Tracy Hedrick's chief year when she was awarded the National Resident of the Year award by the Association for Women Surgeons. To her right is Dr. Hilary Sanfey, who I mentioned earlier was on our faculty and was president of the AWS that year. You can see a number of our faculty and residents from that time in the picture. Dr. Hedrick came to us from Kentucky, where she was a star medical student. We recruited her to our residency. She did her fellowship in colorectal surgery at Penn, came back to us in 2010 on the faculty, has been an ERS pioneer, has been president of the American Society of Enhanced Recovery, and is currently our general surgery division chief, as well as vice chair for clinical operations. This is a great picture of the TCV group. In the front row, Dr. Gangemi, Dr. David Jones, Dr. Ben Kozauer. In the back row, Dr. Gaurav Alawadi, Dr. Crone, Dr. John Kern, Dr. Megan Tracy, and then Dr. Ivan Crosby. I think that's you, Megan, isn't it? That got her JD and MD at the University of Illinois. She is a health policy expert, and we recruited her to our residency, which was our great fortune. She did vascular fellowship here and has been our faculty ever since. She's been, her career has been focused on peripheral vascular surgery and venous disease, and she's been an institutional real leader by being president of the clinical staff, and also is currently the vascular fellowship director as well. A great friend and faculty member. Thank you, Megan. Gib Upchurch. Gib came to us in 2010 after having first done his medical school at UNC, his residency at the Brigham and fellowship at the Brigham in vascular surgery. Was on the faculty at Michigan for almost a decade, where he achieved a rise up to professorship. Dr. Crone recruited him to be the chief of vascular here at UVA in 2010. He was a great faculty leader. He expanded the vascular program, an incredible investigator, has many publications. He left to become chair of Florida in 2017, where he still holds that position. It was my great honor and privilege to introduce him as the president of the Southern Surgical this past December. And Gib is a great fan of our department as well. Carlos grew up in Colombia. He did his residency after doing some research here at UVA. Did his residency with us, then went on to do a critical care fellowship and joined our faculty. He's one of our robotics innovators as well, and has been a stalwart on the acute care surgery group ever since. So yeoman surgeon Carlos, thank you for your years of service. Other faculty, Dr. Upchurch, we mentioned, Dr. Philip Smith, Dan Malouf in transplant, Sean Pelletier, and Ziquan Yang were all recruited by Dr. Crone as well. Philip did his medical school, undergraduate and residency at UVA. He then did a fellowship in endocrine surgery at Columbia and became the associate program director soon after joining our faculty. He's been the director of endocrine surgery since 2015, and he won the Master Surgical Educator Award. Sean Pelletier did his training here at UVA after having done his MD at Hahnemann. He went to Michigan for his transplant fellowship and stayed on their faculty for 7 years. Rejoined us in 2012, has been the director of the liver transplant group since, and is an HPV surgeon par excellence, and has had NIH-funded research and as our division chief of transplant surgery. Ziquan, amazing record. Ziquan grew up in China, got his MD from Beijing University, was a practicing thoracic surgeon in China before coming to the United States, doing research, and then joined UVA residency program. We recognized his talents. He then went on to do a critical care fellowship with us as well, and has been on the faculty doing acute care and clinical surgery ever since then. His research, however, continues in his original area of cardiothoracic surgery. He is a funded researcher in myocardial ischemia and protection, and will be taking over some of the T32 grant responsibilities in the future. He is also an early robot pioneer and a great faculty colleague. Faculty also recruited by Dr. Crone: Mike Williams, Shana Showalter, Vic Sifudum, Sarah Rasmussen in transplant surgery, and James Isbell in thoracic, who is now up at Memorial Sloan Kettering. Mike was here until last year. He joined the faculty in 2012, was one of our trauma critical care surgeons. He took a position in healthcare policy at UVA in Washington. He had been doing that here as before he left. Shana did her undergraduate work here and her MD work at UVA, went to Jefferson for residency, a fellowship in pen and breast surgery, came back to our faculty in 2012, and was a pioneer in instituting the treatment of breast cancer, both with simultaneous surgical and radiation therapy, for which she received NIH funding. Vic Sifudum joined our faculty in 2013 after having done an MD at Brown, residency at Vanderbilt, and an HPV fellowship at the Mayo Clinic. He's been 5 West Medical Director, he's an Outcomes Research Group Director, and he's our Vice Chair of Quality. Other faculty later in the Crone years: Leora Yarborough, Lynn Dengel, Will Robinson in vascular surgery, Mark Roser, and Jeff Gander. Leora did her UNC training in residency at UNC, then did a fellowship here with us. Dr. Crone recruited her to the faculty. She was interim chief of cardiac surgery and has been director of our heart transplant program. Lynn did her MD at Georgetown, was our resident here with us, and went on to MSK for her fellowship in breast surgery, was on our teaching faculty since 2014 and full-time faculty since 2021, with focus in breast and melanoma as her practice, and is the leader of the Muller-Jones Crohn's Surgical Society. Mark did his MD and residency training at UT Southwestern, did his cardiac fellowship here at UVA, went on to Texas Christians for a year of Peds cardiac fellowship, then rejoined our faculty in 2015. He has been a pioneer in Peds lung transplant, and unfortunately will be leaving us very soon. Jeff Gander joined us in 2014 after having done residency and fellowship at Columbia. Is an expert pediatric surgeon and clerkship director of our program at this time. Rudolph Rustin, Sasha Krupnik, Linda Martin, Dustin Walters, and Jose Oberholzer, also recruited by Dr. Crone toward the end of his tenure in faculty. Rudolph was a acute care surgeon, colorectal surgeon. Sasha was a thoracic surgeon, and I'll talk about Linda in a second. Dustin was a thoracic surgeon, and Jose was chief of transplant during those years. Linda did her medical school at UCSD, residency at Minnesota, MD Anderson Fellowship, as a thoracic surgeon, interim chief, and is focused on clinical lung and esophagus, and a leader in national lung cancer research. Dr. Crone has good reason to smile. He did an amazing job as our chair for 15 years, greatly expanding our faculty teaching and clinical missions. This is a picture with him and his wife, Shalia. Now we move on to the chairs. Since Dr. Crone, Dr. Martha Zeiger was our 6th chair of surgery. She came to us from Johns Hopkins. She was a professor of surgery, oncology, and cellular and molecular medicine there, associate VP for research. She was an NIH funded investigator. She's been president of the American Association of Endocrine Surgeons. She's now at NIH and director of surgical oncology. She recruited Carlton Williams in vascular, Dan Levin in pediatric surgery, Suk Hong, and Nick Tiemann in thoracic. Suk is still with us. She's did her residency at UMass, fellowship at Brown. She's got a master's of science in clinical research and has been on our colorectal faculty since 2017. This is a picture of Dr. Reed Adams, who, with his wife Michelle and our guest speaker Mark Talamini at a previous Muller-Jones meeting, Reed succeeded Martha as our chair of surgery, became the 7th chair of surgery at UVA. I've spoken about him a bit already. As I said, he was done numerous things nationally: HPBA, SCS, chair of surgical oncology board. He became a CMO of the UVA regional network after becoming chair here as well. He is an international authority in HPV surgery, as the Claude Jessup Professor, and became an H.S. Hurt Watts Chair of Surgery in 2019. Simultaneously, he was asked to be the Chief Medical Officer in 2019. It became clear that he couldn't do both jobs, and he chose to be Chief Medical Officer, which he's done an amazing job of since then, and still is functioning in that position to our institution's great benefit. Faculty under Reed: Kenan Yount, John Davis, Darren Klaus, Molly Flanagan, Prasad Parivar, and Sandra Kamagabi. Kenan joined us in 2018, having done his training here. He's the director of the Structural Heart and Valve Center. Darren is our chief of vascular surgery. He did his residency at Mayo, at Wilfred Hall, served in the Air Force, did his fellowship at MGH and was on the faculty there before joining us. He's our division chief of vascular surgery and has been president of the Vascular and Endovascular Surgical Society. Molly joined us in 2020, having done her training at VCU and Mount Sinai. She's been one of our faculty in acute care surgery and critical care, and she's also the associate program director. Her husband, Bazad, also joined us in 2020, having done fellowship, his training in similar places, except his vascular fellowship at Maryland. He's been he was an endovascular fellow at Cleveland and was has done an amazing job with branch endograft technology and new technologies and new procedures in that area. And he's the director of our aortic center. Sandra joined us in 2021, raised in Congo, did her MD at Louisville, residency at Davis, and fellowship at Columbia. She's been interested in healthcare disparities in rural surgery. I won't be talking about anybody since 2021 on our faculty. I do apologize, but we do have limitations in our time. But I do definitely want to talk a good bit about Dr. Alan Sung, our current chair of surgery. Alan is our 8th chair of surgery. He did his undergraduate at Cornell, his medical school at SUNY Downstate, and joined the faculty, did his residency rather, and fellowship in oncology, surgical oncology at the University of Pittsburgh. He was on the faculty there from 2008 to 2017, rising to achieve an endowed chair by 2016 and become vice chair of research in 2015. In 2018, he was recruited to be the chief of surgical oncology at Ohio State, and then came to us in 2022 as our chair. And Alan is a funded NIH investigator since 2016 with multiple grants. He's the director of numerous clinical trials, president of the Society of University Surgeons and the Society of Asian American Surgeons, the current Society of Clinical Surgery secretary. He's published almost 300 articles and is on 6 editorial boards. A shout out to Salem Hospital. Salem has been in existence since 1934. Surgery residents have been rotating there since the 1960s. They do PGY 1, 2, and 5 rotations there. Residents usually refer to it as surgery camp because they live there. They do have more autonomy there than in many instances, especially as junior residents. This has been the faculty at Salem since I've been on the faculty here at UVA. The first 5 folks are all retired and did outstanding jobs of teaching our residents. Ari Chowdhury is still there doing general surgery and vascular. Al Weed and Brandy Edwards are stalwarts on the faculty there. Both of them trained at UVA, Al being there the more senior of the two. Bill Dobler is a vascular surgeon, Ralph Butler, a colorectal surgeon, and David Cronin, transplant surgeon, who's currently the head of surgery there at Salem. I have to mention Wayne Wilson. Wayne was the main guy at the VA for many, many years. He did his residency at Ohio State under Zollinger, served in the Army, was the assistant chief of surgery at Walter Reed, and joined the Salem faculty in '77. From then on, he became one of our chief mentors for resident teaching. He was the chief of the VA from '93 to 2005, won numerous teaching awards both at here at UVA and at Salem by their residents, and retired in 2014. We miss Wayne. Research program has grown in size and scope since the Muller days of one main lab. There have been 33 active labs for residents to perform research in since Dr. Muller's lab. There are currently 12 active ones. Our grant revenue from 2024 was over $8 million, and we've had 3 T32 training grants, which is amazing for this department of our size. A shout out to Vic Laubach. Vic is going to be retiring this year. He's been on the faculty since '96, professor since 2013. 2013 has had independent NIH funding since 2002 and mentored 54 residents in the lab. He's on the editorial board for 7 journals. And I also certainly want to mention Beth Turrentine, who did her PhD here at UVA in 2001, has been on the faculty since 2002, is currently a professor of surgery, has supervised our NSQIP project over all the years it's been in existence, and has over 100 publications and is a great facilitator for many of us for our clinical projects. Clinical revenue in the department has gone from 2002 to 2024 from $11 million to $41 million, an incredible growth. I say the title of my talk, Evidence for Greatness. I think what I've talked to you about in terms of faculty achievements, national reputation, residence achievements, including board pass rates and fellowships obtained, speaks for itself. It does justify the fact that we are a great department. Since I've been on faculty, we've finished 166 residents, 63% have held academic positions. If each of them is doing only 200 cases a year, they're now operating on 32,000 patients per year. That is surgical DNA. Currently, our department has 49 clinical faculty, 16 research faculty, 47 residents, 12 fellows, and 80 administrative support personnel. Special thanks to the folks listed on this slide who have supplied a lot of information for my slides. Also our administrative assistants, nurse coordinators, and research faculty and administrators. There is a book that's going to be coming out. I do hope it is published by the time the Muller-Jones-Krohn meeting is next month. It is finished. It is at the publishers. It is called Rise to Greatness, University of Virginia, Department of Surgery, 1971 to 2024. It's been my great privilege to be able to author this book, and I hope that you enjoy it when it does come out. This is a picture taken by Sandy Schenk from his plane flying over the area just southeast of Charlottesville. And with that, I say thank you, and I appreciate your attention. It is up to you folks now in the Department of Surgery to continue the upward trend in our department and continue our rise to greatness. Thank you very much.
Bruce, thank you so much. That was an amazing journey through the history of surgery. I think for all of us here, we recognize that this is a department, this institution. It doesn't happen overnight. It doesn't happen, just in a couple of decades, but you can see many years of great contributors that focus on clinical excellence, compassionate care, academic focus, as well as focus on education of the next generation of surgeons. Bruce, thank you so much. I do want to say that during our Muller-Jones Krohn Alumni Association that's going to be held March 21st and 22nd, we will have a celebration for Dr. Hanks at noon. This is not only for the department, but also for the entire institution and the community here at Charlottesville. So please mark that on your calendar as well. Just want to open up quickly if anyone has any comments or.
I think Laura has a question.
Oh.
Hi, can you guys hear me okay?
Yes.
Yes. Yeah. Thank you so much, Dr. Schirmer. This was so fun. Dad would have absolutely loved this. He loved history, and I think mostly because he loves telling stories. But this was just so much fun to go through. And I know probably for the residents in the room, this might have just seemed like a bunch of old white guys. But for me, this was like family. And growing up, I grew up with Dr. Schirmer's daughters, although I think I was the only one dumb enough to go into medicine, but here we are. And Uncle Sandy is my sister's godfather. That's just what kind of struck me about this talk, is just the fierce loyalty that you all had for each other and the family community that you had. And we were a part of that. And so watching the department grow under you all and just your amazing greatness, it's just inspiring and why I'm at where I'm at now. So thank you so much for this. And we, I'll speak for the whole Hanks family. We really appreciate you doing this for Dad. Thanks.
Thank you, Laura. We appreciate it very much. And thank you, Alan, for making the announcement about the tribute to John. It's going to occur on Saturday of the Muller-Jones-Krohn Society. I think it's looking like it's going to start at 11 o'clock and then have a luncheon to follow on that Saturday.
Any other comments? If not, thank you everyone for attending our Hanks lectureship, and thank you, Bruce, so much.
My pleasure.